Hi. Hi, everybody. Hi. Hello, hello. Hi. Hi, everybody. It's always so much fun to go live, to connect with you all. Hi. And it's also very awkward just saying hi and hello like 100 times when you start a live. Hi, Ganesh. Hi. Hi, Harshit. Hi, Tanmay. All right. Hi, Shivesh. Okay. Hi, everybody. Today we're going to talk about a very, very interesting topic. A depressing but interesting topic. It's about lung cancer awareness because it's the need of the hour. And I have a very, very, very prestigious person who's joining me on this platform today to talk about lung cancer awareness, and he is a very learned person. I'm really excited to be able to converse with him today. So I will just invite him and we will get started. You all have been sending me so many requests to join the live. Hold on. I have Professor Dr. Arvind Kumar joining me for this live today, and he will enlighten us on how best to prevent lung cancer, because we're living in a world where all the metro cities especially are extremely polluted. So even if you're not a smoker, your lungs are not in the best condition. My video is hazy. I'm so sorry. Could be network issues. Let me. Dr. Arvind Kumar. Hold on for just a second, people. Hello.
Hi. Good
Hi.
evening.
Good evening. I hope your day is going well.
Up till now, yes.
Yes, it should be better now on. Just a
Yeah,
second, let
I'm
me turn
sure.
off the comment.
After a meeting with you, it will be better.
All right, so let me just introduce the very learned man who we have today here on the live. Professor Dr. Arvind Kumar is the chairman of the Institute of Chest Surgery in Medanta Hospital. He is also the he's also the head of chest oncosurgery and lung transplantation, and the co-chairman of Robotic Institute, Medanta Hospital, Gurugram. He has received the prestigious Dr. B.C. Roy Award in 2014 from H.E. Sri Pranab Mukherjee, the President of India, for being the eminent medical person of the year 2014. That is fabulous. Dr. Arvind will share his experience now, and we will get started. We'll dive right into the topic and we'll get started about lung cancer awareness. Since this is the Lung Cancer Awareness Month, and since this is your forte, we would really like to hear from you on how secondhand smoking, or living in polluted cities, is really hampering our lung health, and how we can prevent this from happening. Thank you.
Thank you. Thank you, Diksha. First of all, a good evening to you and to all our friends from across the world who joined this conversation between two of us. And I would like to extend greetings to all of them, and also would like to thank them for sparing their time and joining on this, what I consider a very contemporary and a very important discussion on a very important topic. Now, the reason why world celebrates November month as a lung cancer awareness month is that lung cancer has been steadily increasing in incidence in the last decade or so in our country. It used to be a menace in Western countries, but because of control of smoking and pollution, they have been able to at least flatten the curve, if not bring it downwards. But sadly, due to increase in both these reasons, it's seeing a rising trend in our country. Now, before we go into the depth of causes passive smoking, let me just share with all the viewers a difference that I have observed in the demography. The word demography we use for things related to the patient profile. So demography of lung cancer has undergone a sea change. Now, I started my lung cancer surgery career in 1988 at the All India Institute of Medical Sciences. And in 2018, when I was at Gangaram Hospital, I analyzed my data there. So that's a 30-year difference, 30 years span. And I just want to juxtapose 1988 data against 2018 data. So 1988, 90% of the patients were smokers. And in 2018, only 50% were smokers, which means 50% of the patients today are so-called non-smokers. Now, I'll explain later why I'm using the word so-called. Peak age at that time was 50s and 60s. And the reason is that it takes exposure to cancer causing agents for about 30 years before your tissues become cancerous. People used to start smoking at about 20, 25 years of age, plus 30 years, 50, 55, they are ready to get lung cancer. But now that age has come down by a decade and a half, and I'm seeing lung cancer in 40s, and also about 10% of the patients are in 30s. We are also seeing few patients in late 20s. And there is a reason why we are seeing it earlier, and I'll explain it as our discussion proceeds. There were hardly any women at that time. Now 40% of my patients are women who are non-smokers from non-smoking. So there is more and more cancer occurring, number one. More and more cancer occurring in non-smokers, number two. More and more cancer occurring at younger age, number three. And more cancer occurring in non-smoking women, number four. So these are four very frightening developments which have taken place. And allow me to share that lung cancer in lot of cities today, in terms of number of new cancers every year, is at number one position, which means in these cities, and Delhi is one of them, maximum number of cancers which take place every year in males is lung cancer, and it is also rising in its incidence in women. So overall, it's a very bleak scenario. The sad part is that a lot of the cases are not diagnosed in early stage because of various reasons which we'll discuss. And by the time the patients present, it's late, and therefore a lot of these patients die of the disease. So it's a major killer. And that's why we've launched this campaign to make people aware, because it's only through awareness that we will be able to awaken them to the danger. And then we can expect that at least the incidence will go down and the diagnosis will take place at an early stage at which we'll be able to cure these cases. So to summarize, it's a major issue today, and we need to pay attention to this issue. Diksha.
I totally agree. I feel that people are not really aware of how even passive smoking can, really hamper your health, especially your lung health. Like, I remember from a conversation earlier today when you were saying that earlier you used to see pink lungs all the time when you used to do surgery. And then now you see black lungs all the time, even in teenagers. So that actually is frightening. And to realize that it's not just smokers, because we people think that, okay, we're not smoking, so we're safe. But we are not. If we are in an environment that, where, we're passively smoking, we're not really taking care of ourselves. How do you think we should deal with this? Especially people who live in cities like Delhi and Mumbai and Bangalore, which is like where the air quality is also so bad that, even the kids are getting affected. How do you think we should, go about this?
Diksha, first of all, thank you very much. You reminded me about this pink lung, black lung. I did mention it to you in the morning, but it just slipped out of my mind. Yes, I would like to reiterate what you said in maybe harsher words, if I may use that word. So 1988, when I used to open, so I operate about 3-4 cases every day. So when I used to open the chest, I used to do pink. So when we are born, the lungs are pink in color normally. So they should remain pink throughout the life. But when you breathe toxins, carbon, all these dirty things, they get deposited in the lungs and they show up on the surface of the lungs as black deposits, few to begin with. And as the deposits increase, ultimately the whole lung can turn black. So smokers typically have black looking lungs, and newborns have a pristine pink looking lungs. So earlier, I used to see mostly pink lung in people, except those who were smokers. So if you've got some other disease and you're coming for surgery, the lung will be by and large good. But last 10 years or so, Diksha, I yearn for seeing a pink lung. And if I see one someday, I feel like going to temple and bajawing some ghanti. God, I've
Oh
seen a pink
God,
lung
that's
today.
how
God,
bad the
I've seen a pink.
situation is.
I mean, it's something that I go crazy about. Oh my God, I've seen a pink lung today. It's a rarity. And my worst time was when about 6 years back, I saw similar deposits on the lungs of a teenager born and brought up in Delhi. And that really moved me. And I said, no, if I'm privy to this information that the lungs are undergoing such severe change, which people are
Yes,
not aware of, because God
yes,
has given us a lot of extra capacity. So up to 70, 80, 90% of our capacity may get destroyed slowly without our being aware at all. By the time we start having some breathlessness, etc., almost half of our capacity is gone. That's kindness of God that He has given this extra capacity, but that's becoming a nuisance today because then people are silently losing the lung without being aware because of the extra capacity. So now
absolutely.
we are coming out with these images to show to people that this silent revolution is happening inside. It's because of smoking. Earlier it was only smoking, but now it's smoking as much as breathing polluted air. And I would like to share that whatever chemicals are there in the cigarette smoke, which lead to lung cancer, there are about 70 of them, which are known cancer causing agents. Those same chemicals are present in the toxic polluted air also. No wonder that the effect is the same. So whether you are breathing polluted air or you are smoking, the effect is the same, that your lungs get damaged and you get all kinds of lung diseases, the most dreaded of them being lung cancer. And you mentioned, Diksha, about passive smoking. So when you are
Yes,
smoking actively, especially if you use a filter cigarette, your smoke is actually passing through the filter. But when you exhale, or when you are sitting with the cigarette in your hand and that smoke is going all the way, your wife, your
yeah.
spouse, your friend, your child, your parents, or your anyone sitting next to you is actually inhaling smoke which has not yet passed through the filter. So they actually have
Okay.
worse exposure than. So
Oh my
passive
God.
smoking causes as much damage as active smoking does. And no wonder we are seeing an explosion in lung cancer cases. Diksha.
This is which is why I feel like this conversation is so important. I have anyway not lung cancer, but I have lost close family to cancer, and which is why I really wanted to do this and make people aware of the perils of smoking, passive smoking, or just being in a polluted environment, so they could at least be a little proactive and take care of their bodies, take care of their health.
Sure.
I'd love to hear more on secondhand smoking from you. This is the first time I'm hearing the term secondhand smoking.
Yeah, second-hand smoking is as dangerous as first-hand smoking. So first-hand smoking is the guy who actually is having a cigarette in his
Yes.
hand and is smoking. So if you have unfiltered, then you are taking all the toxins. But if you have a filtered cigarette, don't think that filtered cigarette means all toxins are gone. It's a relative reduction. So some of those particles get absorbed in the cotton bud which is there at the end of the cigarette. But when you have that cigarette in your hand and the smoke is going in the air, which is all collecting in a room, which is what we call passive smoke, everybody sitting in that room is inhaling. And the worst thing is that if I'm the smoker, I sit in a room, smoke, and I leave for my office. But all
Yes.
that smoke which I have left in that room will be there
It's
in that room,
inhaled
and
by your
my
family.
wife and my children are there and they keep the doors closed. They may continue to inhale and inhale and inhale that smoke for hours at end, thereby suffering far more damage than what I have done to
Then
myself.
yeah, that's true. That's true. So, how do you think we can make an impact on people who keep seeing all these advertisements where these dangerous, cancerous pictures are displayed on top of even your cigarette packs and everything, and then in movies you have all the "itna tar nichorne wala" ads, which still doesn't like affect people, and it's I mean there's no positive change. I don't know to what extent there is, but in my opinion, I see family and friends watching those ads all the time and then still going ahead and smoking. So how do you think we can actually make an impact and lessen this?
Yeah, that's a very, very practical, very important question, Diksha. And answer is not straightforward. What you have said is absolutely right. The cigarette packs these days carry an advertisement. A lot of hospitals, including Tata Memorial Hospital, have done yeoman service in making beautiful videos with grotesque pictures of patients who had cancers, and they have displayed it widely. People know it, people see it, but despite that, they continue to smoke. The reason is that these companies are striking at the vulnerable time. So, what is happening? The buzzword there is catch them young. So what happens is, suppose there is a children's party. Now,
Yeah.
somebody will be used to introduce a cigarette in that party as a fun.
Yes.
So most of the people, if you go into the history, they would have started it as a fun. And what happens that cigarette has two things. One, it's got nicotine, but
Yes.
along with nicotine, there are these all other cancer causing agents.
Yes.
Nicotine is the addicting part. So what nicotine does is the moment you inhale nicotine, it gets absorbed from the blood, from the lungs, it goes to the blood and it goes to the brain. There's
Okay.
something called blood-brain barrier. It crosses that and it goes to the brain. And the immediate thing that the brain feels from nicotine is feeling good. The moment you take a puff, it goes inside, it gives you a feel good factor. And that feel good factor is so
It
good
is addictive.
and so addicting that very soon people develop a craving for that and start taking as a fun for the sake of getting that kick without realizing that very soon they'll be hooked onto it, and later on they will not be able to leave it at all. So most of the children, most of the people, when I've gone into the details, I have realized that it actually started as a fun activity in a party, then it
That's
converts
true.
into occasional activity, and finally addiction. And then it's so addicting that despite knowing that you are going to kill your lungs, people are not able to leave it. So the answer lies in children, particularly in all the viewers who are there. If they have children, they have access to children. I think 10 to 14 is the most vulnerable age group where people are now getting started or hooked onto it. I would like those children to be informed that 70 cancer causing agents are there. You already are smoking. I would like to inform all the viewers, Diksha, that there is no non-smoker in our country. Now, why do I say that?
Yeah.
Our country, 95% of the people are breathing polluted air. There are two
Yeah.
chemicals that two names that I would like people to know. One is called gases. So you have carbon dioxide, carbon monoxide, ozone, methane, chlorofluorocarbons, all kinds of gases are there. They are called
Yes.
gaseous pollutants. And you have the particles, the particulate matter, which is called PM, particulate matter. And it's termed as PM10, 2.5, 1 or less than 1, depending on the particle size. Now, all these go inside and get deposited in the lungs, get absorbed in the blood and affect everything from brain to toe.
Okay.
Right. So when it comes to lung damage, it has been said that 22 microgram of PM2.5 is equal to one cigarette in terms of damage to the lung. So if you are breathing in a city with air quality having PM2.5 equal to 22, that person has smoked one cigarette in 24 hours. Most of the cities in North India, Diksha, today have PM 2.5 upwards of 350, 400, which is equal to about 15 to 20 to 25 cigarettes. On certain days, it goes as high as 40, 50 cigarettes. So, Diksha, you, me, each one of us is a smoker.
Oh my
I'll
God,
stop.
this is frightening. This is actually frightening. And only yesterday, I think I was seeing in the news that Delhi's air quality has gone even lower. I mean, it's beyond poor now.
Yeah,
And
so we become
very
very poor and
recently,
then very, very poor and then very, very, very poor. So we keep adding or deleting a V. So from four V's poor, if we come to three V poor, we say, oh, we've seen improvement.
Yeah, whereas all of
It's
these are just situations to be in. And very recently, in a survey, also, I was reading that anybody living in a city like Delhi has a shorter lifespan on an average as
yeah,
compared to people living in the other cities. And we were also discussing earlier how, metro cities like Delhi and Mumbai and Kolkata never produce these athletes and these people who win these medals in Olympics, which is I mean, I understand why. I'm sure their lungs are highly affected, their stamina is affected, and which is why people from smaller rural places are doing better in these fields.
yeah, very true. So, Diksha, what happens when you inhale this? We breathe 25,000 times in a day, and in the process, we inhale nearly 10,000 liters of air in 24 hours, which goes inside and comes out. The lungs extract oxygen, but in the process of extracting oxygen, they also get loaded with all these chemicals, pollutants in the polluted air that gets absorbed, goes through blood to brain to every organ. So it causes damage to brain, it causes damage to lung, heart, blood vessels, reproductive. There is no organ in the body which escapes the ill effect. The worst damage comes in children because they have growing tissues. So they breathe faster. Since they breathe
Yes.
faster, they take in more air and they get exposed to per body surface area much more chemicals than adults do. So their organogenesis is affected. So it's proved now that children born and brought up in polluted cities ultimately lead to lower IQ development, lesser lung development, shorter height, and various other. They have diabetes, hypertension, and all other problems. Lung Care Foundation did a study last year where we
Hmm.
studied the lung health of 1,200 adolescent children in Delhi and compared them with 1,200 children each in two southern cities which have less pollution. We were horrified to find that over 50% of these participants complained of persistent chest symptoms in the form of cough, sneezing, chest pain, breathlessness, or some chest problem. 50% of the adolescent children have a persistent chest complaint. More importantly, we did their lung function study on site in the school, and we were horrified to find that 29% of them had test proved bronchial asthma. Diksha, 29%. One
That's a
out of
huge.
every three child in Delhi is an asthmatic, and 90% of them were not aware. Only 5% of them were on treatment. So number one, they have a high incidence. Number two, they are not even aware. And number three, they are not being treated. And it is known that in asthma, if you treat them well, you can actually make them normal. More horrifying was the fact that 40% of the children had obesity or overweight, and those who were overweight had a much higher chance of having asthma than those who were normal weight. So air pollution, we postulated, is acting through two ways. It is causing asthma directly. It is causing obesity, which is causing asthma. So it's a double whammy by which ultimately the children are getting affected. And ultimately, it leads to shorter life. The study you referred to, Diksha,
Yes.
was done by University of Chicago Center in Delhi, and they
Right.
found that average person in Delhi loses about 11
Nine.
years of life
Yeah.
due to breathing Delhi air. In northern India, the value was anything between 7 to 11 years. So all of us will live 11 years longer in Delhi if our air was to meet the WHO standards. So this air is causing damage, it is causing disease, it is causing disability, and it is causing premature death. What more is needed to tell people that air pollution is a medical health emergency? It
Emergency.
needs to be
Absolutely.
responded to in the same way that we responded to COVID last
COVID.
year. And allow me
You're
to
right.
say that every year, air pollution causes more deaths than COVID. But it doesn't get the attention because
That's
it's a
scary fact.
slow poison. Slow poison. It
Yes.
causes
And
slowly.
it's been,
So you
yeah,
don't
it's
see
been
it.
there for so long. It's been there
Yeah.
for so long. People have just gotten used to it. I was earlier discussing with my family how, I was really thinking about this, and I was like, we should really move up to Delhi. We should move up in the mountains and we should live a nice, content life over there. And then they were like, no, we have ease, everything, everything is very convenient over here in Delhi. But I think this is very, very scary. Everything you've just told me, it's very, very scary, and it's kind of inducing panic attacks in me right now. But how do we take care of this? So what you just told me is that even if you're not a smoker, you're still inhaling such terrible quality air, and you're still, like, 1 out of 3 children are prone to asthma or bronchitis, or whatever it was. How do we deal with this? How do we protect our children? How do we protect ourselves, our parents, from this?
Yeah, so two-pronged approach. One is that immediate reaction, because I'm asked this question about 10 times every day by media,
Yeah.
news channels, newspapers, that, sir, how can we protect ourselves in this air? And
Yeah.
the other is long-term solution. So long-term solution, Diksha, is to strike at the sources of pollution, address those, and let me tell you, burning fossil fuels. When I say fossil fuels, whether it is solid or liquid, solid is coal and liquid is petrol, diesel, kerosene, and all these petroleum products. These are the ones which are responsible for major part of the air pollution. In addition, there are other sources, like in Delhi, we have this crop burning occurring in our neighboring states. There is this
Yes. Yes.
construction sites from where a lot of dust comes into the environment. So those are all various sources, but burning of fossil fuels is one of the major
Primary.
sources across our country. And that is why there has been advice by all the people involved in this area to shift to cleaner sources of energy like solar or hydro, etc., and do away with the fossil fuels. So, of course, that will need a lot of policy changes,
Yes.
all the changes. But till then, what do we do? So, I would tell you two terms. They are called dhu and dhu. So, one dhu is dhul, which is dust from any source, and the other dhu is dhua, which is smoke from any source. So let's
Yeah.
start a fight against dhu and dhu. Wherever you see any dust, it could be from a construction site, it could be from a bald patch on the road, it could be from a lot of kacha areas which are left by the side of our highways. Those need to be covered so that the dust is not flying all the time.
Okay.
Diksha, this is one of the major sources across highways in our country, and all of us spend now good amount of time there and keep inhaling all that dust, which also causes. So wherever you can reduce the धूल dust from
Yeah.
coming, please do. Don't think that what can I do, मेरे करने से क्या होता है, वो तो बहुत government करेगी. If we keep thinking that government only will do and government doesn't do, Diksha, who is suffering? Who's
That's
government?
what we
We
all
all are
are. We
government.
all are.
All of us
Absolutely.
are suffering.
I
So
mean, we
let
can
us
depend on
do.
our government for policies, but we need to
Yes,
take steps on an individual level as well.
yes. But let me tell you, when you point a finger at others, three fingers are pointing towards you. So I always say, I care. That's why we've started this campaign, Diksha. I care for lungs. Lungs are doing so much service to you. They are extracting oxygen and keeping you alive. But in the process of discharging their duty, they are getting damaged. So let us start caring for lungs. And therefore, I would request all the viewers to please spread this campaign, hashtag I care for lungs. Now, I care for lungs is about committing yourself to doing everything which protects your lung and not doing things which damage your lungs. So healthy activities, which Diksha, you know better than I know, those need to be promoted. And unhealthy activities like smoking, exposure to air pollution, and all other activities which damage the lung, those need to be stopped. And in that context, I repeat, dhu and dhu. Reduce your exposure to dhul. So anywhere, if you find a bald patch और वहां से गाड़ी निकल रही है, बार बार वहां से धूल हो रही है, take an extra effort, get that covered. थोड़ा सा आई कॉल इट माई सोल्यूशन टू पोल्यूशन कि मैंने भी छोटा सा कर दिया. अगर 1300 मिलियन लोग, आई मीन 130 करोड़ लोग छोटे छोटे स्टेप्स ले ले, I think it will convert into a major step. Same way, wherever you find smoke, whether it is from a vehicle, whether it is from crop burning, whether it is from litter burning in every street across the country, or from any other source, if you start reducing contribution at your level, each one of us reduces our contribution by 10%, I think the pollution will come down by 10%, while we await the government to take the measures which they need to take. And second thing, Diksha, I want to say, reason why pollution has not got the attention that it deserves is because it has not yet percolated to the minds of 1300 million people. Even today, as a doctor, when I travel across the country, address people on pollution issues, I find them say, "Arey, doctor sahab, we didn't know this. Oh, we thought air pollution is a chemical issue, environmental issue. We never knew that it is damaging our children." So I think spreading awareness, Diksha, is important, because when spread awareness is there, they will be awakened, and then people will start asking the government from. I dream of a day where this actually becomes an election issue. People say we will vote for the party which commits to reducing air pollution. I think that is the day where this problem will start getting solved. Diksha.
And that can only happen when people are aware. You're very right about it, because we're all living a very ignorant life where we're not even aware about all of these perils of living in a polluted city. So as long as people are not aware about it, they won't take any measures to fix it. So it's very important that we spread awareness, and I hope that everybody watching here today will take away something from this conversation and will take small measures to take care of themselves, of their bodies, of their children, of their parents, of their families, and spread awareness further. I have two questions here. First one being, how effective are air purifiers? Do they really work?
Okay.
Because if
And
they work,
second,
I'm going to pick them up everywhere, in my car, in my house, in my office, everywhere.
okay. So, Diksha, answer is, if you ask me, does air purifier do anything to the air? Does it improve the quality of air? The answer
Yes.
is yes. But yes comes with lot of caveats. And what are those caveats? The caveats are that air purifier is a device like air conditioner. Air conditioner sucks in air from the room, cools it, and gives it back to the room, thereby cooling the air in the room.
Yes.
So what you need to do, you need to have a compressor which can handle the volume of the room. The doors, windows, everything needs to be closed, and you will have cold air as long as you are inside the room. If you have been in an AC room for 2 hours and then you leave and go to your office, your effect of your room's air conditioner will not go with you. The same principles apply in air purifier also. Air purifier also sucks in air from the room, passes it through filters which clean the air, and then releases it back into the room, just like air conditioner. So you need to have a fan which has adequate air handling capacity. If you have a big room and you install a teeny mini air purifier, it will be no good. Number one. Number two, just as air conditioner's effectiveness depends on the capacity of the compressor, which has to cool, and the cooling coil should be good, same way air purifier's capacity depends on the quality of the filter. When you have such high levels of pollution in the air, the filter gets choked, clogged very quickly. And thereafter, instead of air purifier, it becomes air dirtifier. Because you are passing the air through a room of dirty material, and air actually becomes dirtier passing through that than air. So when the companies sell you the machine, they don't tell you how you have to change. And many people do not change. And I have gone to houses of people, pulled out the filter and showed it to them. Sir, this is the black soot that you are inhaling. And they almost fainted. Oh my God, throw it. So this is the fact. And third thing, it will work if doors, windows are closed only as long as you are in that room. Tell me, Diksha, how many of us can confine ourselves only to our rooms? You are going to market. Can you carry an air purifier with you?
Absolutely
You're
not.
going to
No.
you come to my house. Can you say, Dr. Kumar, please arrange for an air purifier? Then only I'm coming to your house.
That's
So,
impossible.
Diksha, it's a very personal kind of solution, which has a lot of caveats, and air pollution is a public health issue. So, if you can, and plus, Diksha, how many people in our country can afford to have it? So,
That's
as a
not. Yeah.
doctor,
That's
what
not.
is my approach? I recommend it to my patients who have chest problem. So if you have lung cancer, COPD, tuberculosis, bronchial asthma, elderly people, those who are at high risk of having lung problem because of exposure, they are mostly confined to rooms. They're not leading a very active life. I tell them that you must install, but then I give them ideas about the size, frequent changing of filters, etc., etc. It does do some good to them. But for an average active person like you and me, few hours of better air and many hours of worse air, I don't think makes any
It'll
difference.
make
So
much
to
of a difference.
summarize, I would say air purifier is not a solution for the whole country. Solution, Diksha, lies in hitting at the sources of pollution.
We need to start them. We need to start young. We need to get the children aware.
You and me need to start a movement for clean air, people's movement. Let us demand clean air is a human right. Let's demand it, let's work for it, let's ask for it, and let's get it.
Get it. Absolutely. I am on your team. And I hope a lot of other people would be too. Just one last question, because a lot of times cancer goes undetected till the very later stages. How do we go about catching it early? How do we Are there any tests that we need to do regularly? Is there something we need to do proactively to find out how our lung health is? Because
Yeah.
my grandfather used to suffer from COPD, and I have seen him really suffer during his last days because of the breathing problems that he had. So how do we catch it early? How do we really Are there any tests or something?
Yeah, yeah, that's an excellent question. Again, Diksha, very practical question. So, who gets lung cancer? Now, as I said earlier, it was smokers above the age of 50 years who were the high risk population. Now we've reduced that age to about 35, 30. So that's the group. If you are a known smoker, well, but today non-smoker also, to my mind, is as much at risk. The
Yes.
symptoms of lung cancer are persistent cough, a cough which does not go away, and often it will be accompanied by blood in the sputum. Now the problem is these two symptoms, persistent cough and blood in the sputum, is also seen in tuberculosis of the lung, which is far more common in our country than lung cancer. And therefore, the sad part is that many a time the patient do rush to a doctor, but they get misdiagnosed as tuberculosis and are given anti-tubercular treatment for many months before they are diagnosed, by which time the cancer has already spread. Now, the important thing in lung cancer is to diagnose it early, because if you can diagnose early when it's still confined to lungs, you can actually cure it by surgery and by other means. But once it
Hmm.
spreads beyond lungs to other parts of the body, it cannot be cured, it can only be controlled. So the message to people is, if you are above 30 and you have a persistent cough, particularly associated with blood in the sputum, it's a danger sign. You must get a chest x-ray done. Do not get anti-tubercular treatment started just like that. Do go for some kind of a test. It could be sputum examination, bronchoscopy, or a biopsy to conclusively get a pakka diagnosis. Yes, it is tuberculosis. No, it is cancer. So get a diagnosis. Now that's the only way we'll be able to catch the cancer early and achieve cure in this otherwise dismal prognosis of this disease. Diksha.
So when we say persistent cough, what is the time frame that we're talking? Because there are a lot of times that you have a viral and it goes away in 3 days and 4 days, but you still have a prolonged cough. So how do
Yeah.
we realize what is the time frame that we should start really worrying about it?
Yes, sure. So there is no internationally prescribed or fixed time frame, Diksha, but a
Hmm.
typical viral fever or post-viral cough will disappear in 2-3 weeks' time and will never have blood in the sputum associated with that. So if you have
Okay.
a cough which is persisting beyond 6 weeks, particularly if you have even once had a tinge of blood in the sputum. Many times they will have a small amount of blood and you really have to extract this information with patient. Aapko khoon aaya tha? Did you have blood? Oh yes, once I had blood. Oh, once ko they ignore it. So even
Yeah.
one episode of blood in the sputum is a very, very serious sign and you must not ignore it. So any cough which persists beyond 6 weeks and if it's associated with blood in the sputum, you must go to a doctor, must have a chest x-ray. If it shows a patch, don't buy a diagnosis of tuberculosis on the face value. Go for a confirmatory test like sputum examination, biopsy, bronchoscopy to know for sure it is tuberculosis or it is not
Or
tuberculosis,
something else.
and then only start your treatment. I think this is the only way we'll be able to diagnose lung cancer early, which sadly is not happening today, Diksha.
All right, I get it now. This has been such an insightful session. Thank you, Doctor. Is there anything else that you would like to say before we conclude the session? Anything else that
Yeah,
you would like to
first
say?
of all, I would like to thank you, Diksha, for your time and request the viewers who are listening to this and who would have exposure to this at various handles later, that this is a very, it's not about just lung cancer, it's about our lives. Lung cancer is increasing because of pollution, because of smoking increasing. Now we need to spread awareness. It's 100% preventable disease. It's a lifestyle
Absolutely.
disease. It occurs because of the lifestyle. And if we spread this awareness, all those who are watching, if you share this information with your friends, ask them to share and start a chain reaction across the country. Take it as your duty that it's a very vital piece of health information which pertains to health of your relatives, and share this information. The more the people become aware, I think the more they will be awakened. And maybe, Diksha, you and me would have started this small people's movement today on 10th of November 2021, where suddenly this information spreads, people become aware, and maybe 2024 election will be fought on the issue clean air is my right. I need it. Do you commit to it or not? Those who say yes, get your vote. Those who don't get your vote. Diksha.
I'm going to make this my personal agenda now. I'm inspired and how. And I will keep pushing the link to this campaign on my feed every week because I personally feel for it now. And thank you so much, Dr. Kumar. This has been such a great session. I am definitely going to invest more in my lung health as much as my mental capacity allows and make everybody around me aware of this issue. Thank you so much. It's been such a great session.
Thank you.
I've
All
had
of
a
you
wonderful
have a
time. I
wonderful
will push
evening.
out the. You too. Thank you so much.
Bye.
Bye. Hi, everybody. I hope you like this session. I know it can get a little serious, but it is the need of the hour. As Dr. Kumar already mentioned, it is very, very important that we start taking care of ourselves, which is why I keep doing these lives, every few months where I'm talking about either mental health or about your skin or about today it was about lung health. It is so important for someone who's seen close family battle cancer. I think it's very, very important to be aware of something that Dr. Kumar mentioned is a lifestyle disease. Let's just refrain from smoking, please, because every time you smoke a cigarette or anything else, you are really affecting people around you who are not even smoking. So let's try and do that. Let's try and make this lifestyle change. Let's try and make people around us aware about the perils of living in big metro cities, of the polluted air that we're breathing, and let's try and let's try and make individual efforts to fix this. I'm sure every small step would lead to a bigger movement, and something good will come out of it. I will just leave a story with a swipe up link to this campaign. Please, please, please do your bit and spread this awareness. It's a really good and noble thing. So I hope that you all will take this into consideration and make yourselves and people around you aware. Nice talking to you all. See you soon. Bye.